reporting by state officials, and that even the governor and director of health are hiding behind laws so they don't have to provide the public with information. And those laws don't apply. Investigator Dave Biscobine.
So now when we say our leaders are hiding behind health privacy laws, we're talking about HIPAA, the Health Insurance Portability and Accountability Act. Basically, it's meant to protect a person's private medical information, and it's being abused.
It makes no sense.
Incredibly disappointing.
It's not infringing anybody's privacy.
Truthfully, I think it erodes the public's trust.
These are top experts in public information and health privacy. But before we explain who they are and why they have such strong words for our leaders, first, here's why we're speaking to them. For weeks, reporters have asked Governor Doug Ducey and Health Department Director Dr. Kara Christ to release the names and locations of long-term facilities with positive cases. But they won't, even as cases and deaths rise at alarming rates.
We've learned one hotspot is getting even worse.
28 residents have tested positive.
This Chandler facility, now with 16 dead.
Now, this Chandler zip code in particular is a hotspot.
Reporters only learning the truth through leaked emails and tips. And across Arizona, cases and deaths inside nursing and assisted living homes are rising.
55 people who live there have the virus now. 30 employees have also been infected.
That's 85 people in one Tucson nursing home.
In a crisis like this, information is vital. It is truly vital.
PAMELA MARSH leads the Florida First Amendment Foundation and is a former U.S. attorney.
That just seems backwards to me, given what's going on. What do you think?
I think you're exactly right. If we don't know, we can't take the proper precautions, and we don't know the risk.
And we have seen in New Jersey and elsewhere, we've seen these really terrible stories of finding basically dead bodies in some of these nursing facilities.
I. Glenn Cohen is a Harvard law professor, expert in health privacy.
And I think that, anybody who has a loved one in a nursing facility has a lot of questions, and they probably deserve some answers.
Other states are releasing this info, so why won't Dr. Christ and Governor Ducey?
The address or a facility where someone would live would be protected health information, so we consider that protected health information.
And this was what happened when Dr. Christ was pressed by a reporter.
It sounded like you're protecting the facilities over the larger public. There are no HIPAA laws that apply here.
So we are working with the facilities so that they can notify the direct residents and their families who are impacted. And that it is protected health information, and so...
We're going to go to... I got some senior citizen advocate who knows the law very well texting me right now, and she's right. There are no laws protecting...
Well, I'm going to defer to Dr. Christ on this. Thank you.
We're going to Craig and then...
The secrecy doesn't end with state leaders. Dr. Rebecca Sonnenschein, the Maricopa County Health Director, won't release names and locations either.
It's important, however, to focus on making sure that these facilities are comfortable reaching out and working with public health so that they continue to share when they have suspect cases.
So basically it's this agreement like, hey, you can tell us, we won't tell the public. I think that that's probably a check that they can't cash. They're making a promise they're not legally allowed to keep. I mean, it's a promise they can't legally make.
There is no law in Arizona that grants that kind of blank check to public bodies to enter into those sorts of bargains.
David BODNEY is an internationally recognized Phoenix attorney in public record law.
This stuff doesn't violate anyone's personal health information.
Well, here in Florida, I can say that the assisted living elder care lobby is very strong. They've even asked the governor to give them immunity after this is all over.
Well, here in Arizona, in this executive order signed April 9th, Governor Ducey did increase immunity for them. A lobbyist confirming to AZ Central they urged the state to do it.
So you may be, like Florida, dealing with a very powerful, very profitable corporate business. And that may be what they're trying to protect.
Again, the experts say officials are hiding behind HIPAA. It was passed in 1996. In 2003, privacy protections took effect. It was created after medical records went online, making them more accessible to more people. It's intended to keep your personal information from being shared and used to invade your privacy.
If you're asking for general numbers from the government, that's not HIPAA protected.
What's it been like to see this denial of that basic information?
Using HIPAA as a big giant fig leaf and without any justification at all.
Sometimes it's known as the game of empty bottles. You take an empty bottle, slap a label on it, and you call it, in this instance, HIPAA, and you pour all this information into it and say, it's HIPAA, it's personal information, I can't produce it.
It's to everybody's benefit to know this information.
Phoenix First Amendment attorney Dan Barr has spent his career fighting for the public's right to know. He's bothered by another state agency's repeated similar denials. The Department of Corrections refuses to say how many prison officers have tested positive and where. The reason? State and federal privacy laws.
And that just strikes me as not true.
Well, yeah, it's ridiculous. And so that information is not only available, but it's obviously necessary.
Not only is the department blocking it, they're backed by the governor's office. They told us our agencies are prohibited from disclosing information that would reveal an employee's identity or confidential medical information.
For detention officers, they leave the prison, and if they don't know that they've been infected, they're endangering their family members and other people. I mean, it's a danger to society in general.
The secrecy, the experts say, benefits no one, except maybe the secret keepers.
And there is sometimes, unfortunately, an opportunistic use of privacy language.
It makes people wonder, does the state have a reason to hide this information from us?
Why are they hiding it?
When it comes to disclosure, our state health department and corrections department do not have a perfect history. The corrections department kept quiet about broken prison doors for years, letting inmates and officers get ambushed, beaten, killed. And we sued the health department in 2015 to get records proving they ignored more than 1,000 physical and sexual assaults of vulnerable adults in the state hospital. They tried to hide behind HIPAA, but in the end, 6 top officials were fired. And it was Dr. Kara Christ, who Governor Doug Ducey picked to take over.
In these times, when our governors have declared states of emergency because of a health pandemic, when else is this information necessary for public health? This has to be the moment.
So we owe it to the American public when we're asking so much of them.
Well, it's really a no-brainer. I mean, there's no other side to this issue.
Let's be honest with the public. If people in a democracy know what their government is up to, we'll make better judgments.
The real fear, if I were the government, is that I don't give the information to you. You find out later that I withheld the information, and it could have saved a life.
I'm investigator Dave Biskobing, ABC 15, Arizona.